Welcome. My name is Julie Edgar. I am the Communications/Media Relations Specialist at the Area Agency on Aging 1B, which this morning will be known as AAA 1B. And we want to welcome everybody to a very important webinar today. We will be talking about open enrollment, Medicare open enrollment, which starts on Saturday, October the 15th, and goes through December the 7th. It is a time, as most of you know, when Part D or prescription drug beneficiaries and those with Medicare Advantage plans that have a Part D may drop or switch their plans in accordance with their healthcare needs, their budget, and if you choose to change, any new changes will go into effect in January. Anyway, I would like to introduce our speaker, Melissa Devine. Melissa has been with the Medicare Medicaid Assistance Program, or MAP, for the last 5 years. During her tenure, she has been awarded the Site Coordinator of the Year. Melissa believes that healthcare is a right, not a privilege, and that is part of what drew her to MAP. She considers her role to educate and empower Medicare beneficiaries about Medicare so they can make educated decisions that allow them to have healthcare coverage without other lifestyle insecurities, whether it's food insecurity or even homelessness. Support and advocacy are central to her values. Melissa, welcome.
Thank you so much, Julie. Appreciate you guys having me today. All right. I'm going to share my screen here. Okay. Are you guys ready for me to share screen?
One more thing, Melissa, I'm sorry.
Oh, sorry, no worries.
I apologize. I just wanted to go over a couple more things. This webinar is 90 minutes. There's a lot of information to cover, but it will be interesting. Your video and sound will be off for the duration so that you can focus on Melissa. And in the end, we will have a Q&A and we'll restore your audio and video. You are welcome to ask questions. Please raise your hand. You'll see in the Zoom toolbar, there is an icon. You can raise your hand. You can also put your questions in the chat box and we will monitor that and we will get your question asked and answered. The webinar is being recorded and will be available most likely on our website. It will be available on our website most likely by Monday. You will get copies of these slides via email. And please, please, please tell us how we did in the survey that you will receive. So again, thank you for being here.
Thank you so much, Julie, for the introduction. I am going to go ahead and share my screen with you guys. All right. So, as Julie mentioned, my name is Melissa Devine. I am one of the site coordinators here in Region 1B for the Medicare Medicaid Assistance Program. We are through the Area Agency on Aging. And so we do work all together. All right, so today we're going to get started and look at what's new to Medicare. So what we will cover today, anything that's new, whoops, there's a typo, sorry about that. What's new to Medicare for 2023, not 2022, and why we should review your plans each year, what to look for when choosing your plan, And then who MAP is and how MAP can help you save money. All right, so first, what is Medicare? Medicare is insurance for 3 groups of people: those that are aged 65 or older, those who are under 65 with certain disabilities, and those of any age with end-stage renal disease, also known as ESRD. Medicare has 4 parts to it. You have Part A, hospital coverage; Part B, medical coverage; Part D, prescription drug coverage; and Part C, which is the Medicare Advantage plans. Now, enrollment typically takes place through Social Security for most beneficiaries, but for those that are railroad retirees, enrollment will take place through the Railroad Retiree Board. And if you're receiving Social Security retirement benefits or disability benefits, or even railroad retirement benefits, your enrollment may be automatic. However, if it's not, then you'll want to enroll into Medicare during your initial enrollment period, which is a 7-month time frame. Once you've enrolled in your Medicare Parts A and B, you don't have to enroll in them again the following year. What you end up looking at and wanting to enroll in or change is going to be your prescription drug coverage or the Part C Medicare Advantage plans. So when you first enroll in Medicare, and of course during certain times of the year, you can choose how you get your Medicare coverage. There's 2 main ways. The first is through Original Medicare, which is going to give you your red, white, and blue Medicare ID card that has Part A, hospital insurance, and Part B, medical insurance. You will want to then enroll in a standalone Medicare drug plan, which is Part D. And then if you want to help pay some of that out-of-pocket cost in Original Medicare, like the 20% coinsurance, or even that Part A benefit deductible, you can do so by getting a Medigap policy. With Original Medicare, you can use your insurance all throughout the US at any doctor or hospital that takes Medicare. Now, your second option is a Medicare Medicare Advantage plan, also known as Part C. Medicare Advantage is that all-in-one alternative to Original Medicare. And these bundled plans include Part A, hospital coverage; Part B, medical coverage; and typically they roll in a Part D plan for that drug coverage. In many cases, you'll end up needing to use the doctors that are in that plan's network because they are typically HMOs and PPOs. And some plans even offer extra benefits that Original Medicare doesn't typically cover, like dental, vision, and hearing coverage. All right, now we get to take a look at the Original Medicare updates, since we now know all about Medicare. So we're very excited this year. We were able to get the 2023 Part A and B premium and deductible info early. So this year, you guys get to have this info a lot earlier. For Part A, you've got a benefit period deductible of $1,600 this coming year. If you were to stay in the hospital after that deductible period is over, that for 60 days, days 61 to 90 is a $400 copay. And days 91 to 150 is $800. Now, if you needed to go to a skilled nursing facility after your 3-day hospital admission, the first 20 days are covered at no cost. But after that, it's $200 per day. Now, majority of the beneficiaries that we see typically have worked enough into Social Security that they don't have to worry about paying a monthly premium for Part A. However, for those individuals who have not worked enough into Social Security, which is 40 quarters, that premium can be up to $506 a month. When it comes to Medicare Part B, the monthly premium for 2023 is $164.90. It did go down this coming year, which we are very excited to see. And the annual deductible for next year is $226. And a couple of years ago, we had a auto reform change that took place. And so many are still deciding or wondering whether or not they want to keep that unlimited medical auto coverage or elect to utilize their Medicare for that coverage. You're welcome to talk to your auto insurance provider further if you'd like to find out more details, especially specific to their company and your policy. But just at a quick glance, while Medicare does help pay for some of that information or some of those services, it's not going to pay for all of them. So long-term care and custodial care, that is something that Medicare would not cover, but unlimited medical auto coverage would. Likewise, if there's guardianship or conservatorship situations or transportation services for medical non-emergency, even massage therapy or vehicle modifications, alternative pain management, and even wages if you've lost some wages because you were still working when the incident happened. Medicare won't cover those items, but the unlimited medical coverage from the auto insurance will. So just something to keep in mind. Another item you might want to keep in mind is if you have a HSA account. If you have a health savings account with a high deductible health plan based on you or your spouse's current employment, you may be eligible for what we call a special enrollment period to sign up for Part B without penalty. However, when it comes to Medicare Part A, in order to avoid tax penalties, you and your employer should really stop contributing to your HSA at least 6 months before you apply for Medicare. This is because your Part A coverage will start up to 6 months prior from the date you sign up. And you're not eligible to make contributions to your HSA after you have Medicare. If your Medicare Part A coverage overlaps when you made your contributions, you'll have to pay a tax penalty. So if you want to know more about that tax penalty, you'll definitely want to make sure that you talk to your HR benefits coordinator at work and a tax professional to know what that amount might be. But if you do have an HSA and you stopped contributing in time and you don't have to worry about the tax implications, know that you can still withdraw the money from your HSA after your Medicare coverage starts to help pay your share of costs like deductibles, premiums, coinsurances, and copayments. You just can't continue to contribute to it. And while we're on the topic of employer coverage, it's now up to the employer to determine if their coverage is considered primary to Medicare or secondary. So if your employer's plan is secondary to Medicare and you choose to not enroll in Medicare Part B, you will end up with a late enrollment penalty and a gap in coverage. So again, speak with your HR benefits coordinator just to find out whether your employer insurance would be considered primary or secondary to Medicare. All right, and this is the big ticket item for 2023, the Inflation Reduction Act. So this was signed into law on August 16th, 2022 by President Biden, and it includes several provisions. Those would be anything from the creation of the 15% corporate minimum tax rate to energy security and climate change investments. But the one that we're all here to talk about is the Medicare prescription drug price reform. So why did that reform come into place? Well, there's some issues that have been happening within Medicare, specifically the Medicare prescription drug coverage. So where are the issues at? Well, the percent of total US retail spending by payer is far larger than it really should be. And it grew exponentially over just the course of a couple of years even. And with the total Medicare are spending at $99.5 billion, we've got some problems that we really need to take care of. Because the impact of those huge amounts is higher Part D premiums, higher Part D copayments, higher Part B premiums, and a faster depletion of the Medicare Trust Fund, which is what helps ensure that you have Medicare coverage. In fact, all of that, plus 29% of folks in the last year not taking medications because of the cost, and 26% of the Medicare beneficiaries finding it difficult just to afford prescription drugs, that's where we came in with this provision to assist. So within that Inflation Reduction Act provision, it is going to require that federal government negotiates prices for some of the most popular medications under Medicare. It's going to require that drug companies pay rebates to Medicare if the prices rise faster than inflation. It's going to eliminate the 5% coinsurance for catastrophic coverage in Part D. It's going to add a $2,000 cap on Part D out-of-pocket spending, which is awesome because currently that's at $7,000. It's going to limit the annual increases in Part D premiums for just a little bit limited time. It's going to limit the monthly cost sharing for insulin to $35. It's going to expand eligibility for the Extra Help program, which is often referred to as the low-income subsidy through Social Security. It's also going to eliminate the cost sharing for adult vaccines that are covered under Part D so that it can be like it should be and how it is with Medicare Part B covered vaccines. And all of this will delay implementation of Trump's administration drug rebate rule. So if we look at it on a timeline, the big things that are happening for 2023 include the drug companies paying the rebates, that insulin cap at $35 per covered insulin, and the vaccine copay reduction. In 2024 is where we're going to see that 5% coinsurance at the Part D catastrophic level being eliminated, and the expansion of the LIS eligibility. In 2025, we'll see that $2,000 out-of-pocket cap for Part D, which is great, and we're looking forward to that. And then 2026 and beyond is where we're going to start to see the negotiation on some of those Medicare covered meds. So 2026 is going to be the negotiation of 10 Medicare Part D drugs. 2027 is going to be negotiation of 15 Part D drugs. 2028 is going to be negotiation of 15 Part B and D drugs. And 2029 is going to be the negotiation of 20 Medicare Part B and D drugs. So if we look a little closer here at the rebate provision, this is going to be required. It is for single source drugs and biologicals covered under Medicare Part B and all covered drugs under Medicare Part D, except those where the average annual cost is less than 100. The base year for measuring the cumulative price changes relative to inflation is going to be set at 2021. And the rebate amount is going to be based on the units sold in Medicare multiplied by the amount that the drug's price was in a given year, exceeding the inflation adjusted price. Now, this again will take place starting 2023. The Part D provision takes effect right away in 2023, where the Part B provision is going to take effect as well a little bit further into the year. Now, this is expected to limit the out-of-pocket drug spending for those with Medicare, and it's really going to discourage drug companies from increasing their prices faster than inflation. And if these companies don't pay their rebate, they will get a fine. And they also are going to repay those dollars, those rebate dollars, into Medicare's trust fund. So it's kind of a win-win situation for everybody. All right, the next big one is the capping of the insulin at $35. So limiting this monthly cost sharing for insulin is going to take effect again in 2023. Part D is effective January 1st, 2023, and then anything that would be insulin covered under Part B is going to be effective July 2023. But limiting the monthly cost sharing on covered insulins to $35 means that if your insulin is covered under the formulary of your Part D plan, then you will spend $35 per month per covered insulin under that plan. No more. I mean, if it could be less, that would be great, but no more than 35. No deductible will apply to the insulin. And this really is going to drastically help lower the cost for insulin users in Medicare Part D, especially because if you don't have the LIS extra help program through Social Security, then that can be very costly. And so we want to make sure that we can really help everybody afford what they need, including healthcare. All right. And eliminating costs for the adult vaccines under Medicare Part D, again, takes effect in 2023. Any required adult vaccines that are covered by Medicare Part D will be covered at no cost. This is going to eliminate that cost sharing for the adults vaccines under Part D. So that would be like the shingles vaccine. The flu and COVID-19 are under Part B. So I know a lot of people have asked that question too, but this would be more like the shingles, the MMR, the TTAPs, things like that. All right, so let's take a look at any Medigap updates that we have for 2023. As you know, last year we did talk about how some Medigap plans are offering extra benefits, just like the Medicare Advantage plans. Again, something we're very excited about. Some of these extra benefits include dental, vision, hearing coverage, or discount programs, even gym memberships like Silver Sneakers. The companies that are offering these extra benefits are listed here. Of course, this list may increase as we go on throughout the year. But to know that there are several companies out there that are offering these things kind of expands the world of possibilities for your Medicare coverage instead of having to stick to just a Medicare Advantage plan if dental, vision, and hearing was something that was very important for you coverage-wise. All right, now it's the Part D update. So first things first, if you did not have creditable coverage and you did not enroll in Part D, then you will end up paying a late enrollment penalty. That penalty will be added onto your monthly premium, and it will continue with you the entire time that you have Part D coverage. And that amount changes each year because the amount is based off of the Part D beneficiary premium. So that Part D base beneficiary premium for 2023 is $32.74. And I don't know that I would have ever expected to say this in my life before, but I'm going to say it today. This is actually a decrease. This is a decrease in the penalty. I think Medicare just really likes us this year, and I'm not mad at it. So that, again, that late enrollment penalty should be a little bit of a decrease from last year's, and is set at $32.74 for the base beneficiary premium that they use to calculate what that late enrollment penalty would be based off the amount of months that you did not have creditable coverage. Just like the late enrollment penalty, though, there are some incomes that are higher. So if you have a higher income, you will be part of the beneficiaries that pay a sliding scale premium higher for their Part D coverage. This is based on the IRS tax returns from 2 years prior. So for 2023, they're looking at 2021. There are 6 income categories, and each category does have a set dollar amount associated with it. So for more info on that, you can always reach out to MAP. We do have the information right here. So for 2023, the income thresholds will be adjusted each year based off the previous year. And so this year for individual tax filers with incomes that are $97,000 or higher, that's where we're going to see that IRMA amount tacked onto the Part D premium. For joint tax filers with an income above $194,000, again, that's where you're going to start to see that IRMA monthly amount tacked onto the monthly premium. So again, for more details specific to what your income threshold may be, reach out to MAP. We're more than happy to walk through the sliding scale with you. So some Medicare prescription drug plans are going to have what we call a deductible phase. If you jump into a Medicare Part D plan that has a deductible, you're going to start out your coverage in January in that deductible phase. So you'll pay the full negotiated cost for your drugs up to $505 because that is the Part D deductible. Once that deductible is met, you then will pay your set copays or coinsurances for your drugs. And those are negotiated copays or coinsurances. That's part of that initial coverage phase. But once you have paid a total of $4,660 in total drug costs, and that's going to include what you and your plan paid towards your covered meds, you're then going to enter into the coverage gap, which used to formerly be known as the donut hole. Once you're in the donut hole or the coverage gap, you are responsible to pay 25% of the cost of your drugs until you've reached the $7,400 true out of pocket, or the insurance has been billed a total of $11,206 in full retail cost. Now, once those two numbers have been met, that $7,400 true out of pocket or billing the insurance $11,206 in full retail cost, you then enter the catastrophic phase. And that's where you see that 5% cost of the medications. So that's kind of the setup for the Part D benefit structure for this year. Again, that coverage gap is what we used to refer to as the donut hole. You're still expected to pay 25% for generics or brand, regardless, when you are in that phase. Now, the extra help benefit, that is a subsidy that is provided by Social Security, and it helps with the cost of Part D, so the premiums, deductibles, co-payments. There is an income and now, annual notice of changes. You should have received your current Medicare plan's annual notice of change in September. If you haven't received it, look for an envelope from your insurance provider. And just note that it could be on thinner paper, but this is where you're really going to know and be able to check to see what changes are coming for the premium, the deductible, co-payment changes for medications you may have already been taking. You'll know if your medications are still covered, and if they are they covered at the same tier, and are there any restrictions? Because there might be a better plan out there for you. So it's always really important to check those annual notice of changes and review what plans are available to you for the following year. So what is new in the Medicare and U book? Page 37 still discusses the COVID-19 updates. Medicare is continuing to cover coronavirus vaccines, tests, and booster shots if eligible. On pages 17 through 18, there's information on new start dates for Medicare coverage. This is another change we're really excited about. Beginning January 1st, 2023, if you sign up for Medicare during the last 4 months of your initial enrollment period, or if you're signing up during the general enrollment period, your coverage starts the first day of the month after you signed up. Prior to this change, you would have to wait several months to have access to your Medicare coverage. So we're very, very excited that they're not delaying that anymore. On page 52, they discuss some new benefits that will help continue to pay for immunosuppressive drugs beyond the 36 months after a kidney transplant. So for more on the kidney transplants and immunosuppressive drug coverage, you can check out page 52. They also discuss on pages 91 through 96, if an individual has limited income, they may be eligible to have assistance through sources like Medicaid or the extra help low-income subsidy. So those are things to look at on page 91 to 96. And of course, your mental health and wellness are a huge priority. There is help available in a crisis. If you or someone you know is in crisis, call or text 988, or you can chat with them online at 988lifeline.org. So what should we consider when choosing our Part D plan? We definitely want to look at the cost. You want to know what that monthly premium is going to be, what the deductible amount is going to be, what the copays are, whether your insulin is covered on the formulary list, because now we don't have to worry about the senior savings model. Now we have that $35 cap for insulins, so long as they're on the formulary list for your plan. You want to know what tier your medications will fall on. Prior authorizations, quantity limits, step therapy, are those things that you're going to need to do prior to receiving your medications? And of course, everybody wants to make sure that there's nationwide coverage, especially if they're traveling through the US. We've got several folks who like to travel south for the winter, so it's definitely an important thing. And you'll want to look at your pharmacy. Is it considered in-network or not? If it is in-network, is it preferred? Is mail order an option, or is mail order mandatory? Those are some things to consider as well. For 2023, we have 24 different plans just for Part D. That is a lot to choose from, and it only adds to the maze of Medicare. Don't navigate this one alone. Let a MAP counselor help you. We can help you discern what plan is going to be best for you based off of the criteria you may have, which again could include some of those questions we just talked about. So give MAP a call and allow us to help you. We do have 4 plans of the 24 with a 0 deductible. We have 5 plans under $25 for their monthly premium, with the lowest premium at $3.20 a month. That is phenomenal. The highest Part D premium is $112. It is with Prescription Blue premium. They have consistently been the highest Part D premium plan. Hasn't changed in the many years that I've been here. We also have 4 Part D plans that offer gap coverage. So if you were to end up in the gap, then you would have some extra assistance with that. And so we talked briefly a few slides earlier about the Medicare Plan Finder star rating system and the low performing plans. So again, all of this is in effort to promote informed and better choices of high performing plans, but Medicare is disabling the online enrollment feature into low performing plans on Medicare's Plan Finder. These plans will have a low performing icon along with a message warning you that the plan's poorly rated performance is such. And if you're still interested in enrolling in it, then you'll have to contact the plan directly to enroll. Now, some things to consider when you're looking at Medicare Advantage plans. You want to look at the premiums, the deductibles, the copays, just like before. You want to make sure all of your meds are on the formulary list. You want to know what tier they're going to fall on. Again, are you going to need prior auth, quantity limits, step therapy? And again, pharmacies, making sure that the pharmacies are in network, if they're preferred or not. But some of the bigger things that most folks don't really notice right away until they get into the nitty-gritty of this is that you really want to make sure that your primary care physician and specialists are also considered in network. If they're considered out of network, you would potentially need to find new primary care physicians or specialists to utilize in their network. And I don't know about you guys, but I really like consistency with my primary care physicians and specialists. So I would prefer to find a plan that would cover my doctor. They also will cover some extra benefits: dental, vision, and hearing, fitness, transportation, telehealth, and more. But again, some of these may be a separate rider. So you may have to purchase the dental, vision, and hearing benefits instead of just receiving them with the plan. So definitely some things to consider. Now, when it comes to Medicare Advantage plans, we have a lot of them at a 0 monthly premium. You can see just from this slide alone, we have a lot of plans available. In Livingston County, we have 65 Medicare Advantage plans to choose from. Macomb has 65, Monroe has 55, Oakland has 76, St. Clair has 60, and Washtenaw County has 65. So a lot to choose from, and you don't want to do it alone. Contact MAP for more assistance. And again, we are doing appointments in person, we are doing them over the phone and through Zoom. When it comes to Medicare Advantage plans, we do have a lot of them with 5-star ratings, and some that are offering some give back amounts. That was a huge thing last year. That was just kind of started that nobody really knew too much about, but a lot of these plans are offering up to certain amounts that they give back each month towards your Part B monthly premium. So that is something that goes to Social Security so that they don't take full amounts for the Part B premium, that $164.90 every month. So depending on the plan that you jump into will depend on what that amount is. But again, we have all that information handy. So for more info, definitely let MAP know. We're happy to help. If you have a Medicare Advantage plan that is effective January 1st, you'll have the option to do another enrollment January 1st through March 31st. This is what we call the Medicare Advantage open enrollment period. And during this time, again, if you're unhappy with your current Medicare Advantage plan, or maybe you find out that your doctor is not going to renew their contract with that company, you can utilize the Medicare Advantage open enrollment period, January 1st through March 31st, to change to a different Medicare Advantage plan or change to original Medicare with a Part D plan. However, again, I have to stress this, you have to already have a Medicare Advantage plan in place in order to utilize this Medicare Advantage open enrollment period. So again, you must have Medicare.
Now, Melissa, you appear to be free, unfrozen, thawed out.
Oh, okay. I didn't realize I was frozen. I was just plugging away.
Up. You're frozen again. Let's give it a minute.
Where did I'm going to put my and see if that works better.
Okay, wait. You're still frozen. Bear with us for a minute. Just a technical glitch.
Looking better now, not frozen, thought out. Okay, awesome. I am so sorry about that. You gotta love technology, right?
Okay, let's proceed.
Was there a certain slide that I froze on that I should go back to for everyone?
Yeah, go back. I think you were, it was in the 40s.
She was on the Medicare Advantage open enrollment period.
Thank you guys. Ta-da, we're here. All right, well, some of this might be a repeat, some of it might not. So Medicare Advantage also offers an open enrollment period at the beginning of the year. It is January 1st through March 31st. But in order to utilize it, you must have a Medicare Advantage plan in place and effective starting January 1st. During this time, if you were to be unhappy with your current Medicare Advantage coverage, or any other situation that you can think of regarding that Medicare Advantage plan, this open enrollment period gives you the opportunity to change to a different Medicare Advantage plan and or change to original Medicare with a Part D plan. I do want to stress to you guys, though, you do already have to have a Medicare Advantage plan in place in order to utilize the Medicare Advantage open enrollment period. Okay. Marketing guidelines. It is going to be a whirlwind of marketing that you will receive for Part D and Medicare Advantage plans just because it's open enrollment season. So there are certain things that these plans cannot do, and if they do, you want to report it to MAP. MAP is part of the Senior Medicare Patrol, and we can help report fraud and abuse, and of course, issues within marketing that these plans would potentially do. So these plans cannot market themselves as Medicare endorsed. They cannot solicit door to door. They cannot call people on national and state do not call lists. They cannot enroll people over the phone during a solicitation call. They cannot offer incentives or gifts that exceed $15 in value. They cannot market outside of the plan service area. They cannot make cold calls and not conduct sales presentations and collect enrollment applications at the same time at health fairs. So if something like this happens to you or somebody you know, have them reach out to us at MAP so that we can report it. And as you know, fraud and scams are one of the biggest issues with healthcare, but specifically this happens a lot more frequently with those who have Medicare. It's always present. It can be through the phone, it can be through the mail, it can even be billing. Current scams that you might want to be aware of is COVID-19 contact tracing. There shouldn't be anybody that needs your health information in order to do contact tracing. For testing purposes and marketing of vaccines, you want to make sure that you're getting those things done with medical professionals. And of course, we have access to those things a lot easier this year than we did prior. But the biggest thing is don't give your information out over the phone to anybody, unless you know who they are and they absolutely need it in order to process your insurance because it's your primary care or your specialist. And of course, any fraud and abuse that you may suspect is happening to you or a friend or a family member, give MAP a call. Our number is listed here on the slide. It's 800-803-714. So that we can help report those issues. So let's just recap. What can a MAP counselor do for you? Well, we can help you understand your Medicare health plans. We can help compare and enroll in Medicare Advantage coverage. We can help compare or enroll in Medicare prescription drug coverage, so those Part D plans. We can help identify and report Medicare and Medicaid fraud and scams. And we can assist you with enrollment into low-income programs like Medicaid or that low-income subsidy extra help program. And for resources outside of MAP, you have access to the Medicare and U-Book, which is state-specific when it's a hard copy. So if you've gotten your hard copy, it should have all the specific plans for Michigan in the back. And you also have access to Medicare.gov, which is Medicare's website and their plan finder tool. You can always call 1-800-Medicare. But for the best resource for your local Medicare information, that's going to be MAP. Our services are free, they're unbiased, and our certified counselors are not sales agents, and we're not affiliated with any private insurance company. We can be your best resource for all questions and concerns Medicare. There's no question too small or difficult. And we've saved over $2 million for beneficiaries in our area alone. So for a personalized MAP appointment, again, we're doing in-person, we're doing phone and Zoom appointments. Give MAP a call. Our number is 1-800-803-7174. Open enrollment is on Saturday. So you have starting Saturday through December 7th to make changes to your Medicare Part D or Medicare Advantage coverage.